Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The nurse is developing a nursing care plan for a client diagnosed with congestive heart failure. A nursing diagnosis of decreased cardiac output related to inability of the heart to pump effectively is written. Which short-term goal would be best for the client? The client will 1. Be able to ambulate in the hall by date of discharge. 2. Have an audible S1 and S2 with no S3 heard by end of shift. 3. Turn, cough, and deep breathe every 2 hours. 4. Have a pulse oximeter reading of 98% by day 2 of care. The correct answer is 2. Have an audible S1 and S2 with no S3 heard by end of shift. Audible S1 and S2 sounds are normal for a heart with adequate output. An audible S3 sound might indicate left ventricular failure, which could be life-threatening. Ambulating in the hall by day of discharge would be a more appropriate goal for an activity intolerance nursing diagnosis. Option 3 is a nursing intervention, not a short-term goal for this client. A pulse oximeter reading would be a goal for impaired gas exchange, not for cardiac output. When reading a nursing diagnosis or problem, you must be sure that the answer selected addresses the problem. An answer option may be appropriate care for the disease process, but may not fit with the problem or etiology. Remember, when given an etiology in a nursing diagnosis, the answer will be doing something about the problem. In this question, you should look for an answer that addresses the ability of the heart to pump blood.
A patient with proctitis needs a rectal suppository. A senior nursing student assigned to care for this patient tells a nurse that she is afraid to insert a suppository because she has never done it before. What is the most appropriate action in supervising the student? 1. Give the medication and tell the student to talk to the instructor. 2. Ask the student to leave the clinical area because she is unprepared. 3. Reassign the patient to another nurse and send the student to observe. 4. Show the student how to insert the suppository and talk to the instructor. The correct answer is 4. Show the student how to insert the suppository and talk to the instructor. Rationale. Showing the student how to insert the suppository meets both the immediate patient need and the student's learning need. The instructor can address the student's fears and long-term learning needs after he or she is aware of the incident. It is preferable that students express fears and learning needs. The other options will discourage the student's future disclosure of clinical limitations and need for additional training.
The nurse is preparing to administer phenytoin IV push. The client has an IV of D5W0.45 normal saline at 50 milliliters per hour. Which intervention should the nurse implement? 1. Administer the phenytoin undiluted over 5 minutes via the port closest to the client. 2. Dilute the medication with normal saline and administer over 2 minutes. 3. Flush tubing with normal saline. Administer diluted phenytoin and then flush with normal saline. 4. Insert a saline lock in the other arm and administer the medication undiluted. The correct answer is 3. Flush tubing with normal saline, administer diluted phenytoin, and then flush with normal saline. Rationale. Phenytoin cannot be administered with dextrose because it will cause precipitation. Phenytoin should be diluted in a saline solution, and the IV tubing should be flushed before and after administration because a dextrose solution will cause drug precipitation. There is no reason for the nurse to cause more pain to the client by starting a saline lock because the IV tubing is already in place and can be flushed before and after the administration of phenytoin. Anytime a nurse administers an IV push medication, the nurse should dilute the medication. This causes less pain for the client, helps prevent infiltration of the vein, and allows the nurse to administer the medication over the correct amount of time if it is diluted to a 10 milliliters bolus.
The healthcare provider has ordered an angiotensin-converting enzyme inhibitor for the client diagnosed with congestive heart failure. Which discharge instructions should the nurse include? 1. Instruct the client to take a cough suppressant if a cough develops. 2. Teach the client how to prevent orthostatic hypotension. 3. Encourage the client to eat bananas to increase potassium level. 4. Explain the importance of taking the medication with food. The correct answer is 2. Teach the client how to prevent orthostatic hypotension. Orthostatic hypotension may occur with ACE inhibitors as a result of vasodilation. Therefore, the nurse should instruct the client to rise slowly and sit on the side of the bed until equilibrium is restored. If a cough develops, the client should notify the healthcare provider because this is an adverse reaction, and the HCP will discontinue the medication. ACE inhibitors may cause the client to retain potassium. Therefore, the client should not increase potassium intake. An ACE inhibitor should be taken 1 hour before meals or 2 hours after a meal to increase absorption of the medication.
The charge nurse is reviewing the medication administration records for several patients, which situation needs to be brought to the attention of the prescribing healthcare provider. 1. A patient with gastroesophageal reflux disease is receiving omeprazole. 2. An older adult patient with constipation is getting psyllium 3 times a day. 3. A patient who needs a bowel prep is getting a polyethylene glycol electrolyte solution. 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. The correct answer is 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. Rationale. Bisacodyl is a laxative, and laxatives should not be administered to patients with undiagnosed abdominal pain, cramps, or nausea. Appendicitis, diverticulitis, ulcerative colitis, acute surgical abdomens, and bowel obstruction are also contraindications for laxative use. The other patients are receiving medications that are appropriate for their conditions. Omeprazole is a proton pump inhibitor that reduces stomach acid and relieves heartburn. Psyllium is a bulk-forming laxative that is used to treat constipation. The medication needs to be taken with a full glass of water. Polyethylene glycol electrolyte solution is a laxative solution that is prescribed to prepare the colon for procedures, such as a colonoscopy.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for an obese postoperative patient who underwent surgery for bowel resection. As the patient is moving in bed, he comments, "Something popped open." Upon examination, the nurse notes wound evisceration. Place the steps in order for handling this complication. 1. Cover the intestine with sterile moistened gauze. 2. Stay calm and stay with the patient. 3. Check the vital signs, especially blood pressure and pulse. 4. Ask assistive personnel to get sterile supplies. 5. Put the patient into a semi-Fowler position with knees slightly flexed. 6. Prepare the patient for surgery as ordered. 7. Ask the charge nurse to call the surgeon. The correct order is 2. Stay calm and stay with the patient. 5. Put the patient into semi-Fowler position with knees slightly flexed. 3. Check the vital signs, especially blood pressure and pulse. 7. Ask charge nurse to call the surgeon. 4. Ask assistive personnel to get sterile supplies. 1. Cover the intestine with sterile moistened gauze. And 6. Prepare the patient for surgery as ordered. Rationale. Stay calm and stay with the patient. Any increase in intra-abdominal pressure will worsen the evisceration. Placement of the patient in a semi-Fowler position with knees flexed will decrease the strain on the site. Continuously monitor vital signs while the charge nurse notifies the surgeon. An AP can obtain sterile supplies. Covering the site protects the tissue. Ultimately, the patient will need emergency surgery.
The elderly client diagnosed with a stroke is being discharged. When preparing the discharge instructions, the nurse notes many medications that are ordered to be taken at different times of the day. Which intervention should the nurse implement first? 1. Complete a comprehensive chart for the client to use. 2. Refer the client to a home healthcare agency for follow-up. 3. Teach the client to return to the HCP office for follow-up. 4. Discuss the multiple medications and times with the HCP. The correct answer is 4. Discuss the multiple medications and times with the HCP. Rationale. The client has had a stroke and may have difficulty complying with multiple medications and different administration times. Research indicates that the fewer medication administration times during the day, the better the compliance with taking the medication as ordered. The nurse should discuss simplifying the medication regimen with the HCP. Option 1 could be done if the nurse and HCP cannot simplify the medication routine. Option 2 need to be done based on the nurse's evaluation of the client's situation, but it is not the first intervention. Option 3 should be done, but it is not the first intervention and does not address the problem of many medications and multiple administration times.
Along with persistent crushing chest pain, which signs/symptoms would make the nurse think that the client is experiencing a myocardial infarction. 1. Mid-epigastric pain and pyrosis. 2. Diaphoresis and cool clammy skin. 3. Intermittent claudication and pallor. 4. Jugular vein distension and dependent edema. The correct answer is 2. Diaphoresis and cool clammy skin. Diaphoresis is a systemic reaction to the MI. The body vasoconstricts to shunt blood from the periphery to the trunk of the body. This, in turn, leads to cold, clammy skin. Mid-epigastric pain would support a diagnosis of peptic ulcer disease. Pyrosis is belching. Intermittent claudication is leg pain secondary to decreased oxygen to the muscle, and pallor is paleness of the skin as a result of decreased blood supply. Neither is an early sign of MI. Jugular vein distension and dependent edema are symptoms of congestive heart failure, not of MI.
For patients coming to the ambulatory care gastrointestinal clinic, which task would be most appropriate to assign to an LPN/LVN? 1. Teaching a patient self-care measures for an ulcer. 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. 3. Evaluating a patient's response to sitz baths for an anorectal abscess. 4. Describing the basic pathophysiology of an anal fistula to a patient. The correct answer is 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. Rationale. Assisting with procedures for patients in stable condition with predictable outcomes is within the educational preparation of the LPN/LVN. Teaching the patient about self-care or pathophysiology and evaluating the outcome of interventions are responsibilities of the RN. Which instruction will the RN give to the LPN/LVN to determine if the prescribed dronabinol, medical marijuana, is having the desired therapeutic effect? 1. Monitor and report bouts of nausea and vomiting. 2. Monitor the frequency and amount of diarrheal episodes. 3. Ask the patient if heartburn has decreased or resolved. 4. Assess for abdominal pain in the upper right quadrant. The correct answer is 1. Monitor and report bouts of nausea and vomiting. Rationale. Dronabinol medical marijuana is prescribed to treat nausea and vomiting.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A patient is admitted to the medical surgical unit for observation after being evaluated in the emergency department for blunt trauma to the abdomen. Which instructions would the RN give to assistive personnel? 1. Check the patient's skin temperature and report if the skin feels cool. 2. Check the urometer every hour and observe for red or pink-tinged urine. 3. Check vital signs every hour and report all of the values. 4. Check the patient's pain and report worsening of pain or discomfort. The correct answer is 3. Check vital signs every hour and report all of the values. Rationale. The AP can take vital signs and report all of the values to the RN. In this case, all of the values are needed to detect trends. In other cases, the nurse may decide to give parameters for reporting. The RN should assess skin temperature and pain. The RN must also closely monitor the urine output, which is an indicator of perfusion and fluid status. In addition, red or pink urine can signal damage to the urinary system, transfusion reaction, or rhabdomyolysis. Patients who are undernourished or starved for prolonged periods are at risk for refeeding syndrome when nourishment is first given. What is the priority nursing assessment to prevent complications associated with this syndrome? 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. 2. Monitor for decreased bowel sounds, nausea, bloating, and abdominal distension. 3. Observe for signs of secret purging and ingestion of water to increase weight. 4. Assess for alternating constipation and diarrhea and pale clay-colored stools. The correct answer is 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. Rationale. Refeeding syndrome occurs when aggressive and rapid feeding results in fluid retention and heart failure. Electrolytes, especially phosphorus, should be monitored, and the patient should be observed for signs of fluid overload. Changes in bowel sounds, nausea, and distension may occur but are also appropriate for any patient with nutritional issues or for patients receiving enteral feedings. Observing for purging and water ingestion would be appropriate for a patient with an eating disorder. Changes in stool patterns may occur, but are not related to refeeding syndrome. The nurse hears in the handoff report that, 1 hour ago, the healthcare provider requested that the patient be given the maximum dose of magnesium hydroxide. Which instruction is the nurse most likely to give to assistive personnel? 1. Patient will frequently need assistance to the bathroom for bowel evacuation. 2. Patient may experience some dizziness when ambulating or changing position. 3. Patient is frequently vomiting and may need linen and gown changes. 4. Patient needs to be encouraged and assisted to eat and drink as much as possible. The correct answer is 1. Patient will frequently need assistance to the bathroom for bowel evacuation. Rationale. The maximum dose of magnesium hydroxide is given for bowel evacuation and cleansing. It is expected that the medication should take effect within 2 to 6 hours. The nurse is supervising a nursing student who is caring for a patient who had a cholecystectomy. There is a T-tube in place. The nurse would intervene if the student performed which action? 1. Maintain the patient in a semi-fowler position. 2. Check the amount, color, and consistency of the drainage. 3. Gently aspirated the drainage from the tube. 4. Inspected the skin around the tube for redness or irritation. The correct answer is 3. Gently aspirated the drainage from the tube. Rationale. T-tubes should not be irrigated, aspirated, or clamped without specific directions from the healthcare provider. All of the other actions are appropriate in the care of this patient.
The client comes to the clinic complaining of muscle cramping and pain in both legs when walking for short periods of time. Which medical term would the nurse document in the client's record? 1. Peripheral vascular disease. 2. Intermittent claudication. 3. Deep vein thrombosis. 4. Dependent rubor. The correct answer is 2. Intermittent claudication. Intermittent claudication is the classic symptom of arterial occlusive disease. The test taker could eliminate options 1 and 3 as possible answers if the words medical term were noted. Both options 1 and 3 are disease processes, not medical terms. Peripheral vascular disease is a broad term that encompasses both venous and arterial peripheral problems of the lower extremities. Deep vein thrombosis is characterized by calf tenderness, calf edema, and a positive Hohmann's sign. Dependent rubor is a sign of arterial occlusive disease. The legs are pale when elevated, but are dark red when in the dependent position. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.